U.S. could be a tough one. What they're seeing in Australia could spell trouble, especially amid COVID. Joining us today is primary care physician Dr. Andrew Wong with Hartford Healthcare Medical Group to explain more about what to expect. Doctor, thank you for being here. Appreciate it.
No, my pleasure. Good to be here.
All right, first, what caused Australia's flu season to be so bad this year? It's about the worst in 5 years. Is that right?
Yep, that's correct. It's been their worst season in the past 5 years. And we believe it's related to the relaxing of social distancing, people traveling again. But probably the biggest thing has been no longer wearing face masks. Those are the main ways that we've been able to prevent flu over the last couple of years. And now that those have been relaxed, we're seeing increased cases of flu.
And I guess the same thing that's happening down there is what's happening here. If fewer face masks there, fewer face masks here. So we're looking for the same. Is that the tie-in here with the U.S.?
Yeah, exactly. So what happens in Australia is that they're going through their cold, dry winter season during our summer from April through September. And so what we're seeing during those months, we expect to happen here in the Northern Hemisphere starting from September through April of this year. And we're doing a lot of the same things that they did there, with particularly in the schools, not requiring mask wearing anymore, which is, I think a relief for the kids. But it's a double whammy because the kids get more exposure, but also the fact that they don't have developed immune systems. A lot of young kids have never had the flu, or they've never been exposed to flu because we haven't had flu in the last 2 years. And so they're much more likely to get more severe cases of it.
And for those same reasons, the flu is likely to spread more. Are we likely to see more COVID cases as well?
Yeah, I think that's the big question. Are we going to see a scenario where we have spiking cases of COVID as well as flu, a quote-unquote twindemic? They're spread through the same methods, through respiratory particles, through contaminated surfaces. So it's a possibility that with relaxations and restrictions and with people gathering more together in the wintertime, that's something that we are concerned about seeing. The other thing is that if someone catches flu, their immune system becomes immunocompromised because the immune system is fighting flu. It might mean that you're more susceptible to catching COVID on top of it, and that would be pretty brutal.
Briefly, we're almost out of time here. We're seeing reminders to get the flu shot. When's the best timing for folks to do that?
So I've been recommending all my patients get their flu shots right before the flu season begins, because there is a fading immunity that we get after the shot. So the flu shot becomes less effective 3 months and 6 months after we get it. So I've been telling my patients to get the flu shots in early to mid-October, right before the flu season begins. The bivalent COVID vaccine, that's the vaccine that works against the Omicron strains. I've been telling my patients to get that as soon as possible, right, because the Omicron is active. It's going on now. So get that now. Get the flu shot in October.
Talk to your doctor, too. Dr. Andrew Wong, Hartford Healthcare Medical Group. Appreciate your time. Have a great day today.
My pleasure.